Hello everyone, welcome to the S.A.M.E, that is Study Art, Motivation and Education, and in this video we are going to discuss about the contents of the posterior triangle. Okay, so in the last video we have discussed about the posterior triangle's introduction, okay, in which we have discussed about its borders, its roof and its floor. Okay, now in this video it is the part 2 of posterior triangle, and in this video we are going to discuss about the content of the posterior triangle, that is nerves, arteries, lymph nodes. Okay, so firstly we are going to discuss about, as we have discussed in the last video, that we have the posterior triangle divided into two parts, that is occipital and the subclavian triangle. Now this part is divided due to the inferior belly of omohyoid. Okay, now coming to the nerves of the occipital triangle and the subclavian triangle. Okay, first we are going to discuss about the subclavian triangle. Okay, in both of them we have 4 nerves. Okay, first we are going to discuss about the subclavian, because the occipital nerves of the occipital triangle are very long. It is a long part as compared to the subclavian triangle. Okay, so first in subclavian we have 3 trunks of the brachial plexus. Okay, 3 trunks of the brachial plexus. Now all these emerges between scalenus anterior medius. Okay, and carry the auxiliary sheath around them, and which contains, now this auxiliary sheath contains brachial plexus and the subclavian artery. Okay, so what happens that in subclavian in subclavian triangle it has 3 trunks of the brachial plexus which merges between the scalenus anterior medius and carry the axillary sheath. This axillary sheath contains brachial plexus and the subclavian artery. Okay, then we have nerve to serratus anterior, that is C5, C6 and the C7, whereas C5 and C6 is pierce the scalenus medius and join the C7 over the first digitation of the serratus anterior. Okay, then we have nerve to subclavian, that is C5 and the C6. It is on the upper trunk. It is on the upper trunk. It runs lateral margin of the, it runs on the lateral margin of the scalenus anterior. Okay, so you can see that we are just roaming around the scalenus anterior. Okay, so around the scalenus anterior medius we have brachial plexus, then we have the nerve to serratus anterior, then we have the nerve to subclavian. Okay, and this nerve to subclavian runs on the lateral margin of the scalenus anterior. Okay, then fourth or lastly we have the suprascapular nerve, that is C5 and the C6, again on the upper trunk, and it supplies to supraspinatus or the infraspinatus muscle. Okay, now coming to the occipital. Here we are done with the subclavian. Now coming to the occipital. In occipital you have to remember that here everything is roaming around the posterior border of the sternocleidomastoid muscle. Okay, so the very first nerve we have in occipital triangle is the spinal accessory nerve. Now this spinal accessory nerve runs through the tunnel into the fascia, and it runs downward and laterally, and it is the only structure beneath the roof of the triangle. This point is very important. Then we have second we have 4 cutaneous branches of cervical plexus. Okay, now in this 4 we have discussed about the roof in the last lecture, where we have discussed that the roof is formed by the investing layer of deep cervical fascia, in which it has 3 parts: platysma, posterior external jugular vein, and the parts of supraclavicular, greater auricular, lesser occipital nerve, and the transverse cutaneous nerve. Okay, all those 4 are the cutaneous branches of the cervical plexus, and those are we are going to discuss in this part in detail. So first we have lesser occipital. It is on the C2 ventral rami. Okay, and it is the posterior border. So its posterior border supply to the skin of the upper 2/3 of the medial surface of the pinna. Okay, so we have our pinna. Okay, and this is your medial surface. Now this medial surface and this medial surface का upper 2/3 of skin is supplied by the posterior border of the lesser occipital. Okay, coming to the greater auricular. Greater auricular, it has C2 and C3, and one of the very important topic here is that the greater auricular is the largest nerve. Okay, largest nerve in posterior triangles. Okay, now it is divided into two parts, anterior branch and the posterior branch. Okay, anterior branch supply the lower 1/3 of the skin, okay, on the lateral surface of the pinna, whereas posterior branch supply the lower 1/3 of the skin on the medial surface of the pinna. Okay, what is the difference between two? It supplies the lateral surface of pinna, it supplies the medial surface of pinna. Both supply the lower 1/3 skin, whereas the lesser occipital supplies the upper 2/3 of the skin of the pinna. Okay, now two most important point here in anterior branch is that it is the skin over the parotid gland and it connects the auriculotemporal nerve also. Okay, now because it connects the auriculotemporal nerve, it has also the anatomical basis of Fraze syndrome. Okay, so if a person have a Fraze syndrome, then the anatomical basis to diagnose this Fraze syndrome is this anterior branch of great auricular nerve. Okay, now coming to the third part, that is your anterior, or you can say transverse cutaneous nerve. It supplies to the skin, neck and the sternum. Then we have the supraclavicular nerve. Supraclavicular nerve have three parts: medial, intermediate and the lateral. Medial part supply the skin over manubrium till the manubrio-sternal joint. Okay, then we have the intermediate part. Intermediate part is supplies to the skin of first intercostal space till the second rib, and the lateral part supply the lateral side of the clavicle. In this lateral part, what happens? The lateral side of the clavicle and the acromion. If I tell you the diagram, so this is your clavicle and the acromion. Okay, this part is your clavicle and the acromion. Okay, now the lateral side of both clavicle and the acromion supply the skin over half of the deltoid muscle. Okay, so you have to remember this four nerves of the cervical plexus, right? We have four nerves, that is lesser auricular, greater occipital. So we have four cutaneous branches of the cervical plexus, that is lesser occipital, greater auricular and the anterior transverse and the supraclavicular. Okay, now we are going to see the third, or the muscular branches. Now in muscular branches you have three things which you have to remember. First is there are two small branches of levator scapulae. Okay, then two small branches of trapezius, that is both of them are of C3 and C4. Okay, and also you have the third thing which is very important, which is called the nerve to rhomboid. This nerve to rhomboid is proprioceptive and it is of C5, and it is also called the dorsal scapular nerve. Okay, and the fourth and the last is C5 and C6 roots of the brachial plexus. Okay, so these four are the nerves of the occipital triangle. We have discussed the nerves of the occipital triangle. We have discussed the nerves of the subclavian triangle. Now coming to the vessels and the lymph nodes of the subclavian and the occipital triangle. Now first occipital. This part is your occipital triangle. This part is for your subclavicular triangle. So in vessels, if we talk about the vessels, in occipital triangle we have two vessels: transverse cervical artery, which is a branch of thyrocervical trunk. Okay, it is at the anterior border of the levator scapulae. It is divided into two parts. At the anterior border of the levator scapulae, it is divided into two parts: superficial part and the deep branch. Okay, so this, and you have the occipital artery also. So in vessels of the occipital triangle you have two vessels. First is your transverse cervical artery and vein or the occipital artery. Now this here you have to remember that transverse cervical artery is a branch of the thyrocervical trunk and it is divided into two parts at the border of the levator scapulae, that is superficial and the deep branch. Coming to the subclavian part. Subclavian part has four vessels. Okay. First is the third part of the subclavian artery and the vein, suprascapular arteries and the vein. Now this suprascapular is again the posterior branch of thyrocervical trunk. You have to remember this. Then transverse cervical artery is there and the lower part of the external jugular vein. Coming to the lymph nodes. In lymph nodes, you have the lower part. If we talk about the occipital triangle, the lower part is of supraclavicular nodes and upper part have the occipital nodes. And if we talk about the subclavicular triangle, so you have the subclavicular chain in the lymph nodes. Okay, so this is all about the posterior triangle, and here we are done with the posterior triangle. I hope this video helps you in your academics, and if it does, then I would be really grateful. Thank you so much for watching this video. The notes of these particular notes are given in the drive link is given in the description box, and so if you want these notes, so you can go and check that out, those notes. And yeah, this is about it. Thank you so much for watching this video, and don't forget to subscribe the channel. I'll see you in the next video.